this was a retrospective study conducted by a number of European centres, and basically data from 185 patients were retrospectively collected, and 131 of these patients received a starting dose of 400 milligram per day of imatinib, and 54 started with a dose of 800 milligram per day of imatinib. And the bottom line from this study is that patients with tumours harbouring KIT exon 9 mutated, just treated with adjuvant imatinib at a daily dose of 800 versus 400 milligram, did not show better results in terms of survival outcomes. So the 800 milligram dose in this retrospective study was not shown to be better than 400 milligram. Of course, this is a retrospective study, and prospective evaluation would always be required for a retrospective study. But with the current evidence base, this is the best available information that we have to go on to discuss with patients the relative benefits of 4 versus 800 milligrams of imatinib for patients with tumours harbouring the KIT exon 9 mutation.